Today on Cancer Buzz, a clinical trial navigator can help increase clinical trial diversity. Welcome back to Cancer Buzz, the show for the cancer care professional. I'm your host, Summer Johnson. Clinical trial navigators guide patients through the treatment journey by connecting them and their care team to clinical trials. Our guest today is here to tell us how this role became a permanent position on the care team and how they work to increase accrual and diversity in trials. Carrie Friedman is the Clinical Trials Navigator at Virginia Cancer Specialists, PC, in Fairfax, Virginia.
So I think nationwide, there is a challenge of getting patients to enroll in cancer clinical trials. On average, only 5% or sometimes even less of patients with cancer enroll in trials. And there's many barriers to enrolling in trials. That's a whole nother discussion. But so the idea of incorporating my position into the practice was so that we can really begin to take a concentrated focus on increasing those accrual numbers.
How was the Clinical Trials Navigator created?
So the Clinical Trials Navigator role was created from a grant that was open to all U.S. oncology practices. So Virginia Cancer Specialists falls under the umbrella of U.S. Oncology. So Virginia Cancer Specialists was one of the 4 centers across the country that were awarded this Culture of Research grant, is what they call it. And so that's how the position really started. It is absolutely, in my mind, essential to have leadership buy-in. I don't feel that the role would be successful without the leadership buy-in. Certainly, we had the leadership buy-in right from the start because some of our leaders were the ones that applied for this grant. But then, in addition, the leaders really did a great job of educating the physicians about the role before I even came on board. And so once I was hired in the role, it was really nice to see that all of the leadership and physicians were very interested in how I might be able to help them.
How can the role increase diversity in clinical trials?
In the last year, 2 years, there's been a big push. There's a stress on the importance of enrolling a diverse population into clinical trials. As a matter of fact, I had partnered with you all and ASCO on the diversity training. And I do think that that is an important piece for this role to play. I think even this role as a navigator has the opportunity to educate the physicians on how to do that. We are pretty fortunate here in the Washington metropolitan suburbs of having a diverse population that comes to us, but not all centers have that. And so I think a navigator could really play an important role in helping to create that diversity.
How have you seen the Clinical Trials Navigator develop and grow? And then what does the future of the role look like?
We have definitely seen consistency with our internal physicians, which was a major goal. They now reach out to me directly for referrals. And so the number of our physicians across all of our sites that are referring patients for clinical trials has increased and is a sort of a regular day-to-day practice, which is a change from before I even got here. We easily take over 100 referrals a month. And about 6 months ago, that was not the case. It was less than that. And so I think looking forward, we may even need a second navigator who can replicate my role. I think that's to be determined, but it seems that that is the way that we are headed.
Thank you, Carrie. Carrie has a full article on the Clinical Trial Navigator role in this month's issue of Oncology Issues. You can find that in your email inbox from ACCC. Thank you for listening. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Community Cancer Centers.